Welcome back to my channel, Hematology and Blood Transfusion Science Lecture. This is a YouTube channel where we discuss different topics in hematology and blood transfusion science. Thank you for supporting us. Thank you for being part of what we are doing. Thank you for sending in your questions and your feedback. Please, if you have not subscribed yet, this is the right time to subscribe. Today, we are going to be discussing another exciting topic, Lewis blood group system. My name is Dr. Ifeanyi Mary Ann Okafor, a lecturer in the Department of Hematology and Blood Transfusion Science, Faculty of Medical Laboratory Science, College of Medical Sciences, University of Calabar, Nigeria. Learning outcome. It is expected that at the end of this lecture, you should be able to give an overview of what Lewis blood group system is all about. You should be able to mention the antigens that are associated with Lewis blood group system. At the end of this lecture, you should have a good knowledge of the biosynthesis and molecular basis of Lewis antigens. And you should be able to describe in detail the antibodies that are associated with Lewis blood group system and of course their reactivity. And again, you should be able to explain the clinical significance of these Lewis antibodies. Let us start the lecture by discussing the history of this blood group system. In 1946, the groundwork was laid with the identification of the first Lewis antigen by a researcher called A.E. Morat. He discovered Lewis antigen A, the very first Lewis antigen to be discovered. In 1948, another researcher, Andresen, added to this by discovering the second Lewis antigen, Lewis B antigen. And in 1950s, we have group of researchers, Grob, Brandimion, Sinnott et al. This group of researchers shed more light on the unique characteristics of Lewis antigens. They discovered their soluble nature and the ability of red blood cells to acquire them from plasma. The relationship between the Lewis antigen and the secretor genes were discovered around this period. And also, there are some possible application in transfusion medicine were also discovered around this period. In 1963, Morrison et al. Demonstrated the in vivo exchange of Lewis antigens between red blood cells and plasma, solidifying the evidence that Lewis antigens are found in the plasma. This Lewis blood group system that we are discussing today differs from all other blood group systems in that it is primarily a system of soluble antigens present in secretions and in plasma. We've discussed several blood group systems on this YouTube channel, and you will agree with me that majority of these blood group systems, their antigens are primarily found on the surface of the red blood cell, in addition to other tissues and organs, depending on the blood group system concerned, except the ABO that can also be found in body fluid if you are secretors. But in the case of Lewis blood group system, their antigens are primarily found in the fluid. They are primarily found in the secretions and in the plasma. The Lewis antigens on the red cells are absorbed passively from the plasma, and the constant presence of the plasma is actually needed to maintain Lewis antigens on the red cells. There are two basic Lewis antigens. Basically, we have Lewis A and Lewis B, like we said earlier, and others that we are going to look at later. Expression of either of these antigens require the presence of an active Lewis gene, but Lewis phenotype also require the presence of another gene, that is the secretor gene, FUT2 gene. Lewis antigens in saliva and plasma are mostly glycoproteins and glycolipids. Lewis antigens that are found in the saliva and plasma are mostly glycoproteins and glycolipids. We are going to discuss more on this association between the H genes and the Lewis gene. But one thing I want you to know, for you to understand what we are doing today, you need to go back and listen to that lecture on ABO blood group system and also H blood group system, reminding yourself about the biosynthesis of A and B antigens and H antigen will help you to understand what is going on in Lewis blood group system better. Officially, the Lewis blood group system has 6 known antigens, but the main antigen of this blood group system is Lewis A, that is LEA, and Lewis B, that is LEB. Now, the ISBT number for Lewis blood group system is 007, and the ISBT symbol is Le. So the 6 antigens that are found in Lewis and blood group system are the LEA, the LEB, and then you have variations. These variations now are the LEAB, the LEBH, the ALEB, and then the BLEB. When you hear this A refers to the A blood group system, while the B refers to the B blood group system in ABO blood group system. We are going to look at it more when we are discussing the biosynthesis. Of course, you know that H has to do with the H blood group system, the H antigen. So we have the Lewis A, the Lewis B, and then the variations that are the Lewis AB, the Lewis BH, the Lewis ALEB, and BLEB. And of course, I have said the LE, the ISBT number to be 007, and the symbol is LE. And then the gene that is responsible for the production of these antigens, the gene that codes for the production of this antigen is actually FUT3 gene, fucosyl transferase 3 gene, that is found on chromosome 19. The FUT3 gene that is found on chromosome 19. The number of exons, we have 3, and then the initiation codon, the beginning of exon 3, and then the stop codon is within the exon 3. Let us look at the general description of Lewis antigens. The Lewis blood group antigens, at least the main antigens, that is the Lewis A and Lewis B, are generally part of the carbohydrate moieties that are attached to the lipids, that is fucosylated glycosphingolipids, and the glycoproteins. These antigens are not intrinsic to red blood cells. They are not resident on the red blood cells, unlike the other antigens of the other blood group system that are integral part of red blood cell membrane. These ones are not integral part of red blood cell membrane. They are absorbed on the surface of red blood cell from the plasma. These antigens are not intrinsic to red blood cells. Instead, they are enzymatically added to precursor molecules inside the exocrine epithelial cells, and following synthesis are excreted into various body fluids such as plasma, from which the least glycolipids are absorbed onto the red blood cell membrane, giving rise to Lewis phenotype. Remember, we said earlier that we have the glycolipid forms and glycoprotein forms. The glycolipid forms mainly remain in the plasma and other fluids. Then the Lewis structures also appear on other cell surfaces and have functions in embryogenesis, tissue differentiation, tumor cells, metastasis, inflammation, bacteria, as well as viral adhesion. So let's now take a closer look at the biosynthesis of Lewis antigens. The Lewis antigen, like I've said before, are not actually red cell antigens. They are absorbed onto the red cell from the plasma. The presence or absence of the Lewis antigen, that is the Louis A or Louis B antigen is determined by genes at three different loci, three genes. For you for you to be able to successfully produce either Louis A antigen or Louis B antigen. There are three different genes that are actually responsible for that. But we have one main Louis gene, which is FUT3. But for this FUT3 to successfully function in producing Louis A antigen and Louis B antigen, it needs the assistance of other genes in ABO blood group system and H blood group system. And that is number one, the main H gene, which is FUT1 gene, FUT1 gene, frequency transference 1 gene, which is responsible for the production of H substance on the surface of red blood cell and also on the surface of other tissues and organs of the body. It is the precursor substance for A and B antigens. Then we have the second gene, FUT2 gene. The FUT2 gene, that is the SE gene, that is responsible for the production of H, A, B, and H substance in the body fluids. That is the one that makes an individual either a secretor or non-secretor. Remember when we discussed the ABO blood group system and H blood group system, we said those that are secretors, in addition to possessing the first gene, which is FUT1 gene, they also possess the functional second gene, which is FUT2 gene. This second gene, that is denoted by SE, has the ability to make this individual to produce the A or B or H substance in their secretion, like the saliva and other fluid in the body, except the CNS, of course. And then we have the third gene, that's the Louis gene proper now, the FUT3 gene. This gene is the symbol of Louis antigen, and it is given as LE. For you to successfully produce either Louis A and Louis B antigen, you should be able to produce what? The H gene, that is FUT1 gene, the gene that is responsible for the production of A and B substance on the surface of the red blood cell and on the surface of other organs. And then you should be able to also be able to have the functional FUT2 gene, that is the SE gene, the gene that's responsible for the production of A, B, and H substance in the secretion, that is the body fluid. And then you should be able to have a functional Louis gene, that is FUT3 gene. When the LE gene is inherited, when you inherit LE gene, the enzyme that is produced reacts with one of the two possible substrates. But the preferred substrate is the secreted H substance. And this is produced when both the H, that is when both an individual has the FUT1 gene and FUT2 gene, that is the H and SE genes that are present. Then the secreted H substance is then converted to LEB antigen. I want you to understand this very well. This is the biosynthesis of Louis antigens. When you inherit this Louis gene, that is, the Louis gene is FUT3 gene, you are able to produce the enzyme fucosyltransferase 3. This enzyme that is produced reacts with one of the two possible substrates. Remember I said earlier that in addition to being able to produce the Louis gene, a functional Louis gene, you should be able to have a functional H gene and a functional SE gene. Okay. Now, if you're able to have, if you have a, if you inherit a functional Louis gene from your parents, then you should be able to produce the fucosyl transferase 3 enzyme, and then this enzyme can now act on another substrate, is either H gene substrate or SE gene substrate. And then remember that for you to produce, it's not everybody can have a functional SE gene. A functional SE gene are only found in the secretors, people that are able to secrete their A and B substance in their body fluid. Okay, but for everybody who has A or B antigen is has a functional H gene. Okay, so when you inherit LA gene, a functional LA gene from your parents, and you produce the enzyme reacts with one of the two possible substrates. So if an individual is able to have the presence of H gene and the SE gene, then the enzyme reacts with the H substance. The secreted substance is preferred when it is present. It's preferred over the H gene. The S is secreted antigen is preferred over the H antigen. So this enzyme produced by LE Lewis genes react with the secreted H substance and convert it to Lewis B and convert it to Lewis B. The Lewis B antigen is produced when an individual is able to have a functional Lewis gene, and again, in addition to that, the individual must have a functional H gene and again and a functional SE gene. When this is done, the Lewis gene produces the enzyme that converts the secreted H substance to Lewis B antigen. Now, if the secreted H substance is not present, and this can only be as a result of individual not having a functional FUT2 gene, that is, as a result of individual inheriting the recessive form of SE gene, that is the SE gene, the little SE gene. If the individual is not able to secrete A, B, or H substance in the body fluid, then the functional Lewis gene that is present will produce a transferase, and this transferase will now act on the precursor H substance, that is the H substance produced by FUT1 gene, and give rise to Lewis A antigen. So Lewis A antigen is only produced in the absence of SE gene. When SE gene is not present and functional Lewis gene is present, the enzyme produced acts on the precursor substance of H gene to produce LA antigen. But if the SE gene is present in the presence of functional Lewis gene, then the Lewis antigen that is produced in this case is Lewis B antigen. Then if no Lewis gene is present, then neither the Lewis A antigen or Lewis B antigen will be produced. And this will result in a phenotype La minus B minus phenotype. So what we are trying to say is that the biosynthesis of Lewis antigen is dependent on the FUT3 gene that encodes the alpha 1,4 fucosate transferase protein, which catalyzes the addition of a fucus to a precursor polysaccharide. The type of Lewis antigen produced in this reaction depends on the type of precursor molecule the enzyme interacts with. Now, in individual with active FUT2 gene, that is the secretor SE gene, which encodes the fully active alpha 1,2 fucosate transferase. That is, we've discussed this extensively in H blood group system. So please, it may do you well to go back and listen to that lecture on H blood group system and ABO blood group system. It will definitely help you to understand what we are discussing today better. Now, I said here, an individual with active FUT2, that is secretor gene, which encodes a fully active alpha 1,2 fucosate transferase, predominantly Louis B antigen is produced. And depending on the ABO blood group system of the individual, you can also have A Louis B in group A individual, which is made alongside the trace amount of Louis A. But the A that is produced is predominantly very, very undetectable using serological method. So the phenotype of individual concerned is LEA minus B plus. Remember that for you to make B, you must first of all have a functional FUT1 gene, FUT2 gene, and then FUT3 gene. FUT1 gene codes for H antigen, FUT2 gene codes for the secretor status, that is SE gene, and then the FUT3 gene is actually the Lewis main gene. In individual without an active FUT2 gene, that is individual who are non-secretors, only Lewis A antigen can be made because this individual do not have active FUT2 gene. Because they don't have it, they cannot produce the precursor H type 1 antigen, and this will result in the phenotype LEA plus B minus phenotype. In individual with a partially functional FUT2 gene, the biosynthesis of H type 1 precursor is hampered, and much more Louis A antigen can be made, resulting in a Louis A plus Louis B phenotype in individuals who are secretor weak. These individuals are able to produce Louis A antigen and Louis B antigen. This is because the enzyme produced by the FUT2 gene and FUT3 gene, that is the secretor gene and the Lewis gene, compete for access to the same unfuclylated precursor molecules, and this Lewis antigen A form cannot be converted to Lewis antigen B. Although FUT2 gene generally outcompetes FUT3 gene, some Lewis A is made, and hence Lewis AB positive individuals always have trace amount of Lewis A in their system. For individuals without functional FUT3 gene, even if they have FUT1 gene and FUT2 gene, they will not be able to produce either Lewis A or Lewis B antigen. And this individual will have the phenotype LEA minus and LEB minus phenotype, regardless of their FUT2 status. This diagram is just demonstrating that the precursor substance, the polysaccharide, that for you to make the LEA antigen, you need a functional FUT1 gene and a functional FUT3 gene. For you to make Louis B antigen, you need a functional FUT1 gene, a functional FUT2 gene, and a functional FUT3 gene. And then for Louis A, Louis B, in addition, you having FUT1 gene, FUT2 gene, and FUT3 gene, you should also be able to make a specific enzyme that goes for either A substance or B substance. In terms of B substance, it is galactose transferase to add the galactose to the precursor substance to form B antigen in ABO blood group system. While in case of A substance, you know that N-acetyl galactosamine transferase, and that adds the N-acetyl galactosamine to the precursor substance to give rise to the A antigen. So you have A Louis B, as the case may be. Now, let us look at the absorption of Lewis substance by red blood cells. Now, for individuals who are Lewis A positive, that is individuals who have the phenotype LEA plus B minus phenotype, and the individuals who have LEA minus B plus phenotype, if their red cells are incubated in LA minus B minus plasma, these red blood cells lose their Lewis antigen into the plasma. Similarly, if Lewis A plus B minus in the cells, or Lewis A minus B plus cells, red cells are transfused to an individual who is Lewis A minus, Lewis B minus person. The transfused red cells will gradually lose the Lewis A antigen and Lewis B or Lewis B antigens, and eventually become as Lewis A minus and Lewis B minus within 1 week of transfusion. This is very peculiar to Lewis blood group system because remember, these antigens initially are found in the plasma. They are not red blood cell antigens, so they are absorbed on the surface of red blood cell. So when you put red cells of Lewis A individuals in a plasma of Lewis A minus, Lewis B minus individual, this red blood cell of Lewis A individual will gradually lose its antigen into the plasma of the patient who is Lewis A minus or Lewis B minus. The same thing here, if these cells that are positive for either Lewis A or Lewis B are transfused into an individual who is either Lewis A minus and Lewis B minus, the transfused cells will gradually lose the Lewis A antigen or Lewis B antigen and will eventually be grouped within 1 week as Lewis A minus and Lewis B minus. So if the patient has anti-Lewis A or anti-Lewis B, the red cell that were not destroyed in the first few days will no longer be homolyzed once they become Lewis A minus and Lewis B minus. This particular phenomenon has implication for transfusion medicine. Development of Lewis antigens and the red cells. Like we said, the Lewis antigens are poorly developed at birth, and red cells from cord blood are usually Lewis A negative and Lewis B negative. Cord cells are normally typed Lewis A negative and Lewis B negative, as these red cells red, as these red cells Lewis antigen only develop during the first 12 to 15 months after birth. They develop during the first 12 to 15 months after birth. Therefore, Lewis A antigen develops first, followed by Lewis B antigen if the relevant Lewis or secretor genes are present. The interesting thing here is that the cells of children between the ages of 6 months to 4 years are often typed as Lewis A positive and Lewis B positive if they are destined to become Lewis A negative and Lewis B positive individual later in life. The definitive adult Lewis phenotype may not be reached until the age of 4 to 5 years. That's when you can say that this person is actually Lewis A positive, Lewis B negative phenotype, or Lewis A negative or Lewis B positive phenotype. The Lewis A antigen and Lewis B antigens are absorbed onto the red cells from the plasma, but the antigenic strength is variable and may change. Example, pregnant women often type Lewis A negative and Lewis B negative. This table just describes to us the summary of Lewis ABH and secretor gene interactions. For individuals who are Lewis A positive B minus phenotype, the gene that they have is that they have the FUT3 gene, which is the Lewis antigen gene, and then they are recessive for FUT2 gene, and they are non-secretors. They are ABH non-secretors. So Mostly individuals who are Lewis A antigen positive are mostly non-secretors. But for individuals who are Lewis B positive, those individuals have the Lewis antigen, and also they have FUT2, functional FUT2 gene, that is the secretor gene. So these individuals are ABH secretors. For individuals who are Lewis A negative and Lewis B negative, this individual, they don't have the FUT3 gene, the Lewis antigen, and they can be secretor or non-secretor. But the important thing here is that they don't have the FUT3 gene. Inheritance of Lewis antigen. The Lewis blood group system is actually based on the presence or absence of two antigens. That is the Lewis antigen A and the Lewis antigen B. These antigens are inherited in an autosomal recessive manner, meaning they are not sex-linked and they require both parents to contribute a specific gene for them to be expressed in the offspring. Lewis antibodies. Lewis antibodies are generally made only in individuals that are Lewis A negative and Lewis B negative. These phenotypes are the people that mostly make the Lewis antibodies. Anti-Lewis A antibody occurs very frequently. 20% of individuals potentially able to make anti-Lewis A appear to make the antibody. The incidence of Lewis A minus, Lewis B minus phenotype is much higher in the people of African origin. That is, research has shown that the people of African origin are mostly, they have the capacity to be Lewis A minus and Lewis B minus more than the others. And Lewis antibody detectable at 22 degrees Celsius or above may be found in up to 10% of random serum samples from Black people. Anti-Lewis B commonly accompanies anti-Lewis A, and pure anti-Lewis B is uncommon and is made by people who are non-secretors and whose red cells are Lewis A minus and Lewis B minus. Very rarely you will see anti-Lewis B can be made by Lewis A plus and Lewis B minus individuals. Very, very rare for you to see individuals who are Lewis A plus and Lewis B minus making anti-Lewis B. It's mostly found in individuals who are Lewis A minus, Lewis B minus. Now, the nature of these antibodies, whether it is anti-Lewis A or anti-Lewis B, these antibodies are often IgM in nature. They are natural occurring antibody even after deliberate stimulation. They are usually developed by individuals, like I said before, who are mostly Lewis A minus and Lewis B minus. They usually agglutinate the appropriate red cells at 20 degrees Celsius. Yes, because they are IgM antibodies, they are cold antibodies and they react best at room temperature. These antibodies generally react best at temperatures that are below 37 degrees Celsius and react by saline and enzyme technique. They can also react by saline and enzyme technique. And remember, they are IgM in nature, and because they are IgM in nature, they react best at room temperature, typically temperature that is below 37 degrees Celsius. Usually, Lewis antibodies do not agglutinate red cells in saline at 37 degrees Celsius, but can be detected with anticomplement in an indirect antiglobulin test. All Lewis antibodies bind complement and may lyse the appropriate cells. Some examples of anti-Lewis A and anti-Lewis B antibodies can be immune, can be IgG. You know, I said earlier that they are usually IgM in nature, natural occurring, but you can have immune form of these antibodies. You can have immune form of anti-Lewis A and anti-Lewis B, and these immune form are IgG in nature, and they react at indirect antiglobulin test level. Strong reacting type IgG antibodies may cause in vitro hemolysis in the presence of complement. That is, this IgG type of anti-Lewis A or anti-Lewis B can cause in vitro hemolysis in the presence of complement. Some anti-Louis B antibody react best with group O or group A2 Louis B positive cells than with group A1 or group B Louis B positive cells. These are termed anti-Louis BH as they react with cells with the most H antigen. They react more with cells with most H antigen, so they are termed anti-Louis BH. Some patients may have Lewis antibody that can react at 37 degrees. Like I said earlier, these are immune form of Lewis antibody and they are mostly IgG in nature. Anti-Lewis A antibody is usually more hemolytic than anti-Lewis B, and there are some anti-Lewis A plus B that can be very potent, leading to increased intravascular red cell destruction in the initial stage of transfusion. However, during transfusion, all Lewis antibodies can lead to two component survival curves of transfused incompatible red cells. That is, the first cells are destroyed at an accelerated rate, and the remainder will have a normal survival. Like I said when I was describing it earlier, when you transfuse Lewis A positive cells into an individual who is Lewis A negative, what happens is that the, there will be incompatibility, yes. The antibody in Lewis A negative individual can actually attack the red cells, but that is within the first week of transfusion. As these red cells that have Lewis antigen stays longer in the plasma of the individual who is Lewis A negative, they tend to lose their antigen into the plasma. So with time, they lose their all the Lewis antigen that are in the red blood cells, and the antibodies can no longer attack the red blood cells of the transfused, that it can no longer attack the transfused red cells. This is what I'm trying to explain here, that all Lewis antibodies can lead to two component survival curves of transfused incompatible red cells. That is, the first cells are destroyed at an accelerated rate, and the remainder will have a normal survival. The red cells that survive normally have been stripped of their adsorbed Lewis antigen and have become Lewis A negative and Lewis B negative, the same as the recipient. So the transfusion reaction will be aborted, will be halted at this stage. Based on what I just explained, it is therefore recommended that for patients with Lewis antibody reacting at 37 degrees, ABO identical red cells compatible in indirect antiglobulin test level cross-match at 37 degrees should be transfused. It is recommended that for patients with Lewis antibodies reacting at 37 degrees, that patients that have immune the IgG Lewis A or Lewis B antibodies, the ABO identical red cell that is compatible even at the AAT cross match at 37 degrees should be transfused. It is very important to choose ABO identical cells, as A, B, and AB cells carry less Lewis antigens than group A cells routinely used in antibody screening. This is because the A and B transferase compete with the Lewis transferase for the same precursor substrate. The provision of pre-typed Lewis A negative and Lewis B negative blood for patients with Lewis antibody is not necessary, as it is always easy to find cross-match compatible red blood cell at 37 degrees Celsius. Clinical significance of these Lewis antibodies. Like we just said before, transfusion. The majority of Lewis antibodies, they do not cause transfusion reaction generally, because you know that, like I said, they are mostly IgM antibodies, cold reacting antibodies that react best at temperature below 37 degrees Celsius, something like 20 degrees Celsius. But you still have the immune one that is IgG in nature that can cause trouble even during transfusion. Generally, patients with anti-Louis A and anti-Louis B, which reacts at 37 degrees Celsius, can be transfused with cross-match compatible blood. But when transfused with incompatible blood, definitely there will be some reaction. There are, however, some rare examples of Lewis antibodies which react strongly at 37 degrees Celsius by indirect antiglobulin test and activate complement, that is the IgG type, and these antibodies should be considered to be of potential clinical importance. Lewis antibodies do not cause hemolytic disease of the fetus or that of the newborn. This is because most of the antibodies that are formed are IgM in nature. And again, newborn infants do not have Louis A or Louis B antigens. They are mostly Louis A negative and Louis B negative. And most of the antibodies in Louis blood group system are IgM in nature, and they are cold reactive antibodies. They do not cause placenta. Then, what is the practical application of these Louis antibodies? Most examples of Lewis antibodies are not of any clinical importance, but there are rare exceptions that are clinically significant. It is not usually necessary to provide antigen negative blood for transfusion, but Lewis A negative and Lewis B negative screening cells are useful when screening the sera of pregnant women for clinically significant antibodies, as Lewis antibodies, which are not of obstetric importance, will then not be detected, because you know that most pregnant women are Lewis A negative and Lewis B negative. Thank you very much for listening to this lecture. I hope you've learned something. I know that you can confidently give us an overview of Lewis blood group system, what Lewis blood group system is all about, the antigens that are found in Lewis blood group system, the antibodies, the reactivity of these antibodies, and of course the biosynthesis of these antibodies, and then the clinical importance of these antibodies. These are my references. Thank you very much for being part of this lecture. Thank you and thank you. Keep a date with us for more interesting lectures.